Do you frequently feel tired, even after a full night's sleep? Or maybe you're always thirsty and running to the bathroom. These might not just be signs of a busy life. They could be clues your body is struggling with sugar control. When someone has diabetes, the body can't manage blood sugar properly. Over time, this doesn't just affect energy, it messes with your immune system too. That's called diabetes-associated immunological dysfunction. Imagine your immune system as a security team guarding your body. In diabetes, the guards get confused or weak, so germs sneak in easier. That's why people with diabetes often get more infections and heal slower. Does that sound like something you or someone you know has faced? In type 1 diabetes, your immune system accidentally attacks the cells in your pancreas that make insulin. It's like your guards start destroying their own control room. Without insulin, sugar piles up in your blood. In type 2 diabetes, your body ignores insulin resistance, like ignoring a key that should open doors. High sugar levels over time damage immune cells. Think of sugar as sticky syrup in the bloodstream. It gums up white blood cells, slowing them down so they can't fight bacteria well. Poor blood flow from diabetes also means these cells can't reach wounds fast. So the root cause is long-term high blood sugar, which weakens your body's defense team. Ever noticed how a small cut on a diabetic person takes weeks to heal? That's this dysfunction at work. How do you know if your immune system is struggling due to diabetes? Let's play detective. Have you ever had a small foot cut that turned red, swollen, and just wouldn't heal? Or maybe frequent urinary infections, even after finishing antibiotics? These are classic signs. Other clues, often catching colds, skin infections that come back, or gum disease that won't go away. High blood sugar helps bacteria and fungi grow faster, like leaving food out in the sun. Yeast infections, especially around genitals or mouth, are common too. Fever might not spike as high as it should because the immune system is too tired to respond. So if you feel always a bit off but can't pinpoint why, especially with known diabetes, your immune system might be whispering for help. First, they check blood sugar. Tests like fasting glucose, HbA1c, which shows average sugar over 3 months, think of it like a monthly report card for your sugar levels. If those are high, diabetes is likely. Then, if you keep getting infections, they might run immune tests. For example, checking white blood cell count or how well your neutrophils, infection fighters, work. Treatment isn't just about one pill. It's a team effort. Taking insulin or diabetes meds to control sugar, antibiotics for active infections, and wound care. For example, a diabetic with a foot ulcer may need daily cleaning, special shoes, and blood sugar control to heal. Also, vaccines, like flu or pneumonia shots, are important. They give your weak immune system extra tools. Have you ever skipped a flu shot because you never get sick? For diabetics, that's a risky gamble. Can you stop this immune weakness before it starts? Absolutely, it's like fixing your car before it breaks down. First, manage your blood sugar. Regular checks at home with a glucose monitor help. It's like checking your speed while driving. Eat balanced meals, less sugar and junk food, more veggies and whole grains. Exercise, even 20-minute walks daily, can make your body respond better to insulin. Avoid smoking. It damages blood vessels and immune cells together. Stay hydrated and keep skin clean, and moisturize to avoid cracks where germs enter. And don't ignore small cuts. Clean and cover them. Think prevention like daily habits, brushing teeth, but for your immune system. Do you take your health seriously only when you're sick? Switching to daily care can save you months of healing later. Science is making cool progress. Imagine smarter insulin that adjusts on its own, like a thermostat for blood sugar. New closed-loop insulin pumps do just that, reducing sugar spikes that hurt immunity. Researchers are also studying how gut bacteria affect immunity in diabetics. Maybe probiotics will one day help. Another exciting area: drugs that reduce inflammation and boost immune response without causing harm. Trials on immune-modulating therapies show promise in helping wounds heal faster. Also, telemedicine apps now remind patients to check sugar, take meds, and spot early infection signs, like a health buddy on your phone. Just like apps help you track steps, soon they might track immune risk too. Isn't it exciting that today's research could turn a chronic struggle into a well-managed life?